Okay, so we've strengthened the muscles around the knee, we've strengthened the bottom muscles, the stomach muscles, inner thighs. Now we're going to work on the hip joint, which is so important to try and support that knee when you're recovering from any form of surgery. So you're going to lie yourself down on your side, and the upper leg is going to be the surgical leg, okay? It's really important that you get that right. Otherwise, particularly when it's quite soon after surgery, it may be pretty sore in this position. From here, you're going to straighten out that upper leg as much as you feel you can. It's totally normal if you still have a little bit of a bend in it. From there, we're going to be working on this outer bottom muscles. You're going to pull the stomach muscles in, flex the foot, lower it down to the floor, and then lift it back up again. And you're aiming to lift it the height of the hip, the height of the upper hip. Coming up, pulling the stomach muscles in, squeezing the bottom muscles, up and lower. Now you're aiming for 10 of these. If you're more advanced, you can push it a little bit further. The key with this exercise is to feel it in the bottom muscle, the outer bottom muscle. So if 10's too easy, double it up. Don't cheat yourself, guys. Up and lower.